Welcome back. I'm Mabel John. You're watching coverage of the World Healthcare Congress in Washington, D.C. And welcome to those who are joining us via live stream. Right now in our studio we have John Bulger, Chief Medical Officer, Population Health at Geisinger Health System. Geisinger Health System serves over 500,000 members throughout central Pennsylvania, New Jersey, Delaware, and Maine. Welcome.
Thank you. Thank you.
Now, you have a goal really to be agile and responsive to the people that you serve. You have a lot of members in your system.
Yes.
So how do you achieve that?
I think it's a view of the people we take care of, and also a view of the population, the communities we take care of. So we try to be able to provide a baseline level of care for everybody, but at the same time understanding that that different members of our community have different needs, and trying to be able to understand what those needs are and be able to parse out so we can get the care we need to the people we need.
Mm-hmm. And you also try to deploy systems that address hotspots.
We
what
do.
do you term as hotspots?
So we do some work around risk adjustment, and that risk adjustment is somewhat the classic risk adjustment that people are used to in trying to figure out who's sicker and who's not as sick from a healthcare standpoint, but also looking at social determinants of health and realizing that the social determinants of health play a large role in people's health. So sometimes they're not able to get transportation, sometimes they're not able to get food, sometimes they're not able to have housing, and how do we work on those as well? And realizing that those hotspots that we talk about, sometimes it's about their medical or health care, sometimes it's about what's going on in their social situation. So being able to work on both of those is important for us.
Oh, okay, so you have special teams you deploy to address sort of the basic needs?
We do. So we have teams, and really at all different levels. So we use nurses, social workers, sometimes community health workers. So there's a whole group of people which we deploy at different levels, and we try to understand what each person needs to have that done. So in some cases, if it's a very complex medical patient, they need a nurse to help them. If some cases, if the issue is housing or food or some other things, we can have other members of the team maybe that aren't nurses or aren't licensed medical professionals do that work. So it's really trying to understand what the patient's needs are, understanding what tools we have in the toolbox to meet those patient needs, and trying to marry those up.
Okay, and have you done a lot of work in really gathering the data to determine that this really matters and does result in a better cared for patient?
We have. I think data is really key to this. Data on the front end to understand what the needs are, and then data on the back end to say, is what you're doing helping, and how do you tweak how you're deploying those tools to make it help, and understanding which tools work in which situations, because it isn't always intuitive, and understanding that data and really following what you do over time is extremely important.
And how do you build the care teams that are appropriate for certain situations?
So the teams do change by the situation, and they change by the patient situation and somewhat the situations around the health plan. And really the goal is to understand that it takes a team to do this, that those teams really are better when they have a bunch of different members of the team that are helping and have input, because each member of the team touches the elephant, if you will, in a different place and brings a different perspective to the care. So really getting multiple different members of the team with different viewpoints has been extremely helpful.
You'll be addressing attendees of this conference a little bit later. What are some of the key takeaways you hope to leave with them?
Yes, I think one of them is we've discussed about having the data. So you really need to have the data to be able to make decisions. Another piece is you need to have tools in your toolkit, and those tools have to be varied because different patients, different people in different communities have different needs, and then being able to marry those tools together and say, how do I get the right tools to the right patient? And that's being able to actually use the data in a way that's useful. And I think in the last piece is then evaluating what you do, because medicine and healthcare is changing so much. And what you did today may not be what you do tomorrow. So being able to continually evaluate and innovate around how we're caring for people.
Okay, we're so pleased to have Geisinger back here this year.
Yeah, it's great to
What
be here.
keeps you coming back to this particular meeting?
I think there's just a wealth of opportunity to network and to understand what other people are doing. As I said, a lot of what's going on in healthcare is innovation, but a lot of it's imitation. And understanding, you don't have to create everything yourself, and understanding that there's a lot of us working in the direction of trying to have better health for people and communities. And how do we learn from each other so that we're not all reinventing the wheel? So I think coming to a conference like this and hearing what other people are doing, whether it's in the meetings or networking offline, is extremely important.
Great, thank you so much.
Thank you.
Thank you.
It's great to be here.
And I've just been speaking with John Bulger. Stay tuned, we'll have much more content to come. You're watching the World Healthcare Congress 2017.